Nosebleed can be frightening but not usually a sign of anything serious and can often to be treated at home. The medical name for a nosebleed is epistaxis. During a nosebleed, blood flow from one or both nostrils. It can be heavy or light and lasts from a few seconds to 15 minutes or more. What to do to stop a nosebleed? First, sit down and firmly pinch the soft part of your nose just above your nostril for at least 15 minutes. Lean forward and breathe through your mouth. They will drain blood into your nose instead of down the back of your throat. Place an ice pack or bag of frozen vegetable covered by a towel on the bridge of your nose. Stay upright rather than lying down, as they reduce the blood pressure in the blood vessel of your nose and will discourage a further bleeding. If the bleeding eventually stops, you will not usually need to seek medical advice. However, in some cases, you may need further treatment from your GP or an hospital. When to seek medical advice, contact your GP or call NHS 24-1111 service if you are taking a blood thinning medicine or anticoagulant such as warfarin or have a clotting disorder such as hemophilia and bleeding does not stop. You have symptoms of anemia such as heart palpitation, shortness of breath, and a pale complexion. A child under 2 years of age has a nosebleed. You have nosebleed that go regularly. Ask someone to drive you to your nearest accident and emergency department or call 999 or an ambulance if the bleeding continues for longer than 20 minutes. The bleeding is heavy and you lose a lot of blood. You are having a difficulty breathing. You swallow a large amount of blood that make you vomit. The nosebleed develop after a serious injury such as a cut. What causes nosebleed? The inside of your nose is full of tiny, delicate blood vessels that can become damaged and bleed relatively easily. Common causes of nosebleed include picking your nose, blowing your nose very hard, a minor injury to your nose, changes humidity or temperature causing the inside of the nose to become dry and cracked. Occasionally, bleeding can from the blood vessel deeper within the nose. This can be caused by a blow to the head, recent nasal surgery, and hardened arteries or arteriosclerosis. Who gets nosebleed? Nosebleed are fairly common and most people will experience them every now and again. Anyone can get a nosebleed, but they most often affect children between 2 and 10 years of age, elderly people, pregnant women, people who take blood thinning medications such as aspirin or anticoagulant such as warfarin, people with blood clotting disorders such as hemophilia. Bleeding may also be heavier or last longer if you take anticoagulant, have a blood clotting disorder, or have a blood pressure or hypertension. Are nosebleeds serious? Nosebleeds are not usually serious. However, frequent or heavy nosebleed may indicate more serious health problems such as a high blood pressure or a blood clotting disorder and should be checked. Excessive bleeding over a prolonged period of time can also lead to further problems such as anemia. If your GP suspect a more serious problem is causing your nosebleed, they may refer to you to an ear, nose, and throat ENT, especially for further tests. Preventing nosebleed. Things you can do to prevent nosebleed include avoid picking your nose and keep your fingers short. Blow your nose as little as possible, only very gently. Keep your home humidified. Wear a head guard during activities in which your nose or head could get injury. Always follow the instructions that come with nasal deconstant. Overusing this can cause nosebleed. Talk to your GP if you experience nosebleed frequently and are not able to prevent them. They may refer to an ears, nose, and throat or ENT specialist for an assessment. So once your nose has stopped bleeding, you should follow the advice below to reduce the risk of your nose bleeding again and to stop you picking up an infection. First, avoid blowing or picking your nose, heavy lifting, strenuous exercise, lying flat, and drinking alcohol or hot drinks for 24 hours. Do not remove any crust that form inside your nose. This may be unpleasant, but they are useful part of the healing process. If you need to sneeze, try to sneeze with your mouth open to reduce the pressure in your nose. Avoid people with cough and colds. If you see a GP or hospital doctor about your nose, they may give you a prescription or an antiseptic nasal cream once the bleeding stops. This should be applied to the inside of your nostril several times a day up to 2 weeks to help prevent further bleeding. If your nose does start to bleed again, follow the first aid advice above and seek medical advice if the bleeding does not stop.